Most people believe that shaking hands are something that only happens to older adults. Others assume that if their hands begin to tremble, it must automatically mean a serious neurological condition. After more than 25 years of caring for patients, I've learned that both assumptions can be misleading. Here's what nobody tells you. Hand tremors can have many different causes, some surprisingly simple, and others more important to investigate. Sometimes the reason is temporary. Sometimes it's related to a lifestyle habit. Sometimes it's your body's way of asking for attention. And in many cases, the earlier you understand what's happening, the more options you have to address it. That's why today's conversation matters, because a trembling hand may seem like a small thing, but understanding its cause could help protect your health, your confidence, and your peace of mind. My name is Dr. Michael Anderson. I'm an internal medicine physician, and for more than 25 years, I've worked with patients of all ages, helping them understand symptoms that often create confusion and concern. One of the most common questions I hear is surprisingly simple. Doctor, why are my hands shaking? It's a question that can generate a lot of anxiety because people immediately imagine the worst. Yet the reality is often much more nuanced. Today, I want to walk you through 7 hidden causes of hand tremors that people frequently overlook, explain what's happening inside the body, and discuss what steps you can take if you're experiencing this symptom yourself. Before we explore the specific causes, let's first understand what a tremor actually is. Think of your muscles, nerves, and brain as members of an orchestra. When everything is coordinated, movement appears smooth and controlled. You reach for a glass of water. You write your name. You button a shirt. The signals flow effortlessly. But when those signals become disrupted for any reason, even slightly, small involuntary movements can appear. That's what we call a tremor. The important thing to remember is that a tremor itself is not a disease. It's a symptom, a clue. And like any clue, it needs context. The first hidden cause is stress and anxiety. Many people underestimate how powerfully emotions affect the body. They assume anxiety is something that happens in the mind, but anxiety is also physical. When you're stressed, your body releases hormones that prepare you for action. Your heart beats faster. Your muscles become more alert. Your nervous system becomes more active. A slight tremor can sometimes be part of that response. I remember a young professional who became convinced he had a serious neurological disorder because his hands shook during presentations. After careful evaluation, we discovered that the tremors appeared primarily during periods of intense stress. Once he learned stress management techniques and addressed the underlying anxiety, the shaking improved dramatically. Research consistently shows that stress can significantly worsen or trigger tremors in susceptible individuals. If you've noticed that your hands shake more during stressful situations, have you ever considered that your nervous system may be playing a role? But that's only part of the story. The second hidden cause is caffeine. Most people love their morning coffee, and honestly, coffee has benefits. It can improve alertness, concentration, and energy. There's nothing inherently wrong with enjoying it. However, caffeine is a stimulant. It activates the nervous system. For some people, especially those who are sensitive to it, excessive caffeine can make the hands noticeably shaky. I once treated a college student who came in worried about worsening tremors. After discussing his daily routine, we discovered he was consuming multiple energy drinks and several cups of coffee every day. When he reduced his intake, his symptoms improved significantly. The tremor wasn't a mysterious disease. It was a response to overstimulation. Do you consume caffeine regularly? And have you ever noticed a connection between caffeine and shaky hands? The third hidden cause involves sleep deprivation. This one surprises many people. Most individuals understand that poor sleep affects mood and energy levels. What they don't realize is that it can also affect coordination and muscle control. The brain relies on sleep to restore and regulate countless processes. When sleep becomes inadequate, the nervous system may become less efficient. Small tremors can emerge. I remember a nurse working long shifts who noticed her hands trembling during routine tasks. She feared something serious was happening. Yet after improving her sleep schedule, the tremors became far less noticeable. Sleep is not a luxury, it's a biological necessity. Have you been getting enough quality sleep lately? The fourth hidden cause may be one of the most overlooked: medications. Many people assume that if a medication has been prescribed or purchased over the counter, side effects will always be obvious. In reality, certain medications can contribute to tremors. Asthma inhalers, some antidepressants, certain stimulants, and other medications may affect the nervous system in ways that produce shaking. I recall a patient who spent months worrying about a neurological condition before we realized the timing of his tremors coincided perfectly with a medication adjustment. Once the issue was identified and discussed with his healthcare team, a solution was found. The lesson here is not to stop medications on your own. The lesson is to recognize that medications can sometimes play a role. Have you recently started a new medication or changed a dosage? Now let's discuss a cause that many people never suspect: low blood sugar. Here's where things become interesting. The brain depends heavily on a steady supply of glucose for energy. When blood sugar drops, the body activates emergency systems designed to restore balance. One result can be trembling. You may also feel weak, sweaty, lightheaded, or unusually hungry. I once cared for a patient who repeatedly experienced hand tremors during the late afternoon. He assumed stress was responsible. Further investigation revealed episodes of low blood sugar related to irregular eating patterns. Once his meals became more consistent, the tremors improved significantly. Have you ever noticed your hands shaking when you're hungry or after skipping a meal? The sixth hidden cause involves thyroid function. Most people don't spend much time thinking about their thyroid gland, yet this small gland has an enormous impact on metabolism and energy regulation. When the thyroid becomes overactive, the body essentially runs too fast. The heart may beat more rapidly, energy levels may feel unusually high or unstable. Tremors can develop. I remember a woman who initially blamed caffeine for her shaking hands. She cut back completely, yet the tremors persisted. Blood testing eventually revealed an overactive thyroid. Treatment addressed the underlying problem, and her symptoms improved. What happened next surprised even her. Other symptoms she hadn't connected to her thyroid began improving as well. Were you aware that thyroid problems can sometimes affect your hands? The seventh, and perhaps most important hidden cause, is a neurological condition known as essential tremor. This condition is actually one of the most common causes of persistent shaking. Many people have never heard of it. Others immediately assume that any tremor must mean Parkinson's disease. But essential tremor is different. It often runs in families and typically appears during activities such as writing, eating, or holding objects. I've cared for many patients with essential tremor who lived full, active, productive lives. The key was understanding the condition and managing it appropriately. While neurological conditions deserve evaluation, not every tremor automatically indicates a severe disorder. Have you noticed similar symptoms in family members? Throughout my career, one thing has become clear. People often fear the unknown more than the reality itself. I remember a young father who became convinced that his hand tremors signaled a devastating disease. He spent months worrying before seeking medical advice. After a thorough evaluation, we discovered that a combination of stress, poor sleep, and excessive caffeine was contributing to his symptoms. The relief on his face was unforgettable. Not because the tremor disappeared overnight, but because he finally understood what was happening. So what should you do if your hands are shaking? Start by paying attention to patterns. When does the tremor occur? Does it happen during stress? After caffeine? When you're tired? Are there other symptoms? Keep a simple record if needed. Ask yourself whether the tremor is getting worse, interfering with daily activities, or affecting your quality of life. These observations can provide valuable information for your healthcare provider. It's also important to ask practical questions. Am I sleeping enough? Am I consuming excessive caffeine? Have I started any new medications? Am I eating regularly? Have I noticed changes in weight, energy, or mood that might suggest a thyroid issue? Small questions often lead to important answers. I want to share one final story because it captures the heart of today's message. Several years ago, I met a woman in her 40s who had developed noticeable hand tremors. She became embarrassed during social situations and started avoiding activities she once enjoyed. During our evaluation, we discovered a combination of factors: chronic stress, poor sleep, and excessive caffeine consumption. Together, we created a realistic plan, nothing extreme. Better sleep habits, reduced caffeine intake, stress management strategies, follow-up monitoring. Over the next several months, her tremors improved significantly. More importantly, her confidence returned. She stopped fearing the symptom and started understanding it. That shift changed everything. If there is one lesson I hope you remember today, it is this: symptoms are messages, not verdicts. A shaking hand is not automatically a sign of something catastrophic. It is information. Information that deserves attention, curiosity, and sometimes evaluation. The sooner we seek understanding, the more empowered we become. Today we discussed 7 hidden causes of hand tremors: stress and anxiety, caffeine, sleep deprivation, medications, low blood sugar, thyroid problems, and essential tremor. Some are temporary, some require medical attention. All deserve thoughtful consideration rather than fear. I'd love to hear from you. Have you ever experienced hand tremors? What seemed to trigger them, and what helped you the most? Share your experience in the comments below. Your story may help someone else who is searching for answers. And if you found this discussion helpful, consider sharing it with a friend or family member who may benefit from it. Thank you for spending this time with me. Stay informed, stay curious, and remember, understanding your body is one of the most powerful investments you can make in your health.